Hey everyone, Dr. Reams here with Dr. Reams Concierge PT. I'm here today with John. We are going to be talking about some Sigvaris products. Today specifically, we're going to talk about the Compreflex, which personally is one of my favorite products of theirs. We've been talking about some other ones, so I might change my favorite, but as of this recording, this is one of my favorite of their products. So we're going to go into that. And John, go ahead and introduce yourself and who are you?
Yeah, so everyone, my name is John Hoffman. So happy to be back once again. I am one of the product specialists as well as trainers for Sigvaris. And I am so excited to talk to you about Compreflex today because it's actually my favorite product. So speaking about the Compreflex, I have one right here on a leg form. This is the wrap we're going to be talking about today. So do you think maybe first, why don't you share with me just a little bit about what your experience has been with the wrap? Because you have used this before.
Oh, yes. Oh, yes. And some of my patients wish I used it sooner. So Compreflex is my go-to for the legs, especially below the knee for nighttime. That's first thing I think of when someone needs nighttime compression. I go to the Compreflex because we can't wear just typical socks at night. So that's pretty much a guarantee. If you need nighttime compression, lower extremity, from me, you can guarantee I'm going to be ordering Compreflex. The other times that I look at it are those, who have decreased sensation. So diabetes or, some sort of spinal cord injury or stroke is if there was a bunching in the sock or something during the day, you may not feel it, which can cause injury. And so that Compreflex really helps with containment without that risk of injury if you don't have good sensation. Mobility is another issue is sometimes those socks are hard to put on. The Compreflex is another one that I like to go to. And while this is not exactly what it was intended for, what I found some help with is those who don't have help at home for bandages. If we need to decongest or get a little bit smaller, not, 20 size smaller or whatever, but a little bit of that getting it smaller, and they don't have help at home, the Compreflex can help there. There are products out there for, if it was more complicated. But this is a nice way to kind of save money and help the person out is if we start with the garment they're going to end in and kind of use it to shrink a little, and then they already have the garment.
I have to say, I like your philosophy. I think it matches quite well with what we try to do here at Sigvaris. So, well, let's talk a little bit about the Compreflex and who's it for and kind of like what we have available. So the Compreflex is going to be for patients with venous ulcers. This product here is coded for wound care. So if they have an open venous ulcer, this will be covered by Medicare.
That's huge, you all. Do you hear that? Medicare will cover this.
Medicare, yes. And it's the only real necessity is that the wound actually has to be open when it's prescribed. So just make sure that you would prescribe it before that wound is closed. But so for our wound care patients or general vascular CVI, along with stage 1 or 2 lymphedema and lipedema, and then our patients that have a hard time donning traditional compression. So really, one of the benefits about this product is that it's a multi-disease state product. So probably preaching to the choir just a little bit here, but I think that the understanding is that patients with vascular issues, that's a precursor to lymphatic issues since the lymphatics drain that system. Wounds can be either venous or lymphedema, so we can get to the wound care center from kind of both those branches. So we're seeing more groups of people that are working together with lymphedema and wound care, and this product can cross those bounds so that you have one product that is designed to be containing enough, but also get that coverage for that wound so it's not out of pocket, and something that's going to be low enough profile where it's not going to really, get in the way too much, especially if you do wear it during the day. So we have a calf, we have a knee, and we have a thigh. Typically, the calf is, I think, the most popular. You and I talked a little bit about the knee and thigh, and I'm going to show a picture of them right here. just so you guys can kind of see here what this full system looks like. But the knees and thighs are great for those patients that need a high level of containment, but also sometimes they can be some downsides to that, such as if they have bathroom issues.
I don't care which company, which garment, if you're going basically from the ankle up to the thigh, a garment that way, they're a bugger to keep up. Is there's a time and a
Exactly.
place it's necessary, but they're hard to keep on. And from a manufacturer standpoint, I don't envy them because it's not easy to do.
Exactly. Especially when you're thinking about a lot of our patients have a little fluffier thighs. And so we're kind of increasing that the angle and increasing that slouch, and then the knee moving kind of scooches and moves the material. But let's talk about a few solutions for that, right?
Yes.
So my first solution would be included with our thigh piece. We actually have a hip attachment, and it was designed with the intention to help with some of that slide. What I found through, talking with therapists, working with patients over the last, 5-6 years in particular, is that it helps, but it does not fix the problem. The best way to keep that garment from slouching is going to be our Compra shorts. These are available either in a short or a capri length, off the shelf, small through 5XL, which is over 200 centimeters in the waist, lymphedema specific sizing with wider hips, and they're very cost effective. These work great to pull over top of those knee and thigh garments to keep them locked in place. It also covers the entire sternum, or up to the sternum, so you have all of that extra coverage through the abdomen, and you can use chip pads or things to address spot issues there as well. Sometimes you may have a patient that you can go directly into the shorts, maybe the capri length, and skip the knee and the thigh. So when we're looking at gradient compression, we have 30 to 40 at the ankle. By the time we get up to the thigh, we only have about 10 to 15. So these shorts are right around in line with our gradient compression. They're just not going to be quite as containing. So if you have a patient whose thighs are really aggressively refilling, that's when you're going to want those wraps. But if they're not quite to that point, I would recommend using a capri or short first, because it's just a pair of pants, and it's that compliance or that adherence rate we see rise when we can make something just a pair of pants, just something easy that you use daily.
From the clinician standpoint, is when you get a little bit of compression over the inguinal nodes and over the pelvis, that helps with that lymphatic drainage as well. Is, we're getting into some of that anatomy, but when we get those shorts and we get that area covered, it helps a little bit more, especially if you're getting some swelling up into your thighs. Odds are there's probably some in the pelvis somewhere. Whether it's visible or not is a different story. So getting some shorts can definitely help with that side, as well as making it a little bit more comfortable and easier to wear throughout the day. So that's kind of the hip and the knee. There's also a foot or a boot piece. You saw on the model that there's a bit of a sock underneath. That is a transition sock. My preferred way to go when I can, because it fits into the shoe a little bit better. Sometimes people have a hard time reaching their foot, so the boot can be a little tricky. It's another piece to put on. So transition is my preferred, and they're not as strong as a traditional sock. So some of those things I was talking about, don't go, wait a minute, you said you don't like socks. This is different. But there is a boot for those who have a lot of swelling in their foot, who don't wear shoes maybe around their house, who need that extra containment. So let's see that boot, John, and hear your side of it.
Yeah, so we have several different ways that we break down the Compreflex. So as you mentioned, the Compreflex transition, that's this one here, includes that liner with 10 to 15 compression just on the foot and ankle. And then there's no compression on the top of the sock. So this was kind of our answer of, if someone has limited mobility and the boot's going to be a little too hard, if we just have a little bit of compression here to keep that reflux from heading back, the wrap's going to cover the rest of it, so we don't really need any compression there. For our patients with the fuller swelling, we have our Compreflex standard with the boot. And so this is going to come with just a regular one size fits all liner. It's non-size, so it just slides on really easily. It's meant to accommodate up to a 68 centimeter calf, so kind of beyond the size of our largest calf. And then it's going to include a simple boot. So this boot opens up right across the top. There's a heel hole that you can see here to locate that heel, and then just two simple straps closing over the top. So like you mentioned, this is that extra step for our patients that have maybe some problems traversing down to their feet. It's not something that we just add unless is necessary, because that liner tends to fit more patients' needs and is going to be a lot easier to don. But if we got foot swelling, that little bit of elastic liner isn't going to do as much as something like this that contains. We also have the some gripper patches that can be purchased separately. So if you are wearing this at night and you have to get up to use the bathroom, this is obviously just kind of a smooth surface. So we have little Velcro rubber tabs. You get 2 of them, and those stick to the bottom of this garment and give you a better, firmer footing so you don't slip when you get out of bed like that.
It is Fall Prevention Awareness Week, so good job getting that in there. Yeah, so they really truly value the safety and care of their patients, and being able to wear these safely day and night, as we kind of talked about and whatnot. So how long do these garments last? If someone needs one or their therapist recommends one, what are they looking at for the length of this?
If you take care of this, launder it regularly, follow the instructions, the care guide, you keep it out of your dog's mouth, that type of thing. We see typically 9 months to a year. We do have a manufacturer's defect warranty on the product for 6 months. So that means when you pull it out of the box for 6 months, guaranteed the Velcro will work, nothing will rip off, the stitching's all good, all of that type of stuff. And if you have any issues, it's a free replacement. But beyond that, our typical life that we see out of this is going to be 9 months to a year. So how do we know when we need a new one? This is a garment here that we can start to see some of. I'll try to get close here. You can see how this material is starting to kind of pill and rise up a little bit through here. Not quite as smooth as this brand new material. There's a good shot where you can see where that Velcro has kind of peeled up over here throughout time. So we're starting to see that Velcro is having an effect on the bed where it's lying. It still does attach, but it doesn't attach quite as strong. The other thing that we see is the actual Velcro is starting to lose its Velcro stickiness. This does not hold very well. You can see how easy that is to pull, as opposed to, you hear that crispy, that Velcro is working like it should. But as soon as the Velcro stops being effective, like this one, that's when you need to replace it, because I'm no longer going to be able to pull it to that compression strength and have that hold without, coming loose. So again, typically 9 months to a year, but talk to your therapist if you notice that the Velcro is not quite sticking like it should. And they would probably recommend that it's time to look at a new one.
Yeah, and I see my patients that wear it day and night, or have higher active lives during the day when they're having to move and work and walk their dogs and all of that stuff. That 9 months to a year is pretty accurate. My patients that are a little bit more sedentary, or only maybe wear it at night, they get a little bit longer out of it, right? And so definitely lifestyle plays a role there. Yeah. And then I've seen patients wash these, I think, 100 different ways. Despite the care instructions, despite education, they do what they do. And so that definitely affects the life of the Velcro. Is there a whole bunch of dog hair getting in with it?
Exactly. Fabric softeners, that changes the consistency of the textile. That really is not good. You know, drying it too much. You can tumble dry or treat it like a delicate. That's what we always recommend. Just launder them like a delicate. You can dry them in the dryer. You can wash them in the washer. Just no fabric softeners, no bleach, very gentle detergents, and then either tumble dry, or if you have the ability to air dry, that always actually gives you a little bit longer longevity. One thing that I want to talk about is just how it dons. And
Yes.
I think that this is something too that you and I had talked about just a little bit, but one of the features for this garment is that a patient can actually don it. That's we're trying to avoid what I like to call the compression octopus. So we have this little retainer strap right here, and from the therapists I've talked to and the patients that I've talked to, this is kind of one of the reasons why they like it, right? And it's because the straps are kind of tucked back neatly out of the way. They're not sticking to the dog, to the couch, all that stuff. And now I can take my time. If I have a little hard time getting down there, you know, I might need to take a couple of trips. And this gives me the time to do that. It allows me to make sure I've seated it correctly to the right height, that I'm closing my straps without gapping so that there's no area for that swelling to push through. And then I'm also going to be able to set my compression strength with my AccuTab. I'm actually going to show you a video that demonstrates not only how to properly set the AccuTab, but also just how to don the Compreflex. So let's take a look at this real quick. You can actually find this video at our YouTube page, Sigvaris Group USA on YouTube, and we have a lot of other donning videos that could be helpful for you as well. Make sure your skin is clean and dry. Begin by donning one of the supplied liners. It may be easier for you to fold the liner in half as shown, or simply pull the liner on. With the stretch panel facing forward, slide your leg into the wrap. Pull the garment up the calf until it is roughly 5 centimeters or 2 fingers width from your knee crease. Close the straps without applying any tension, making sure that they are flat without gaps. Place one AccuTab device per strap as shown here, making sure that the size and AccuTab print are facing the strap. Apply each strap to the desired compression level. So not only can we safely take a prescription for a circular knit for someone like my grandmother who is 84 and has very bad arthritis, she's not going to be able to pull apart a sock. She can put this on though by herself. So we can match that prescription strength given by the doctor, a 30 to 40, and get her into something that's going to, again, suit her needs, especially since she's single at home by herself. And so she needs something that she's going to be able to self-manage.
And so there is, you know, there's a little practice that goes into getting it to the right tension. You'll often find one strap is easier than others to get to that tension or something like that. But using those AccuTabs, referencing back to that video, this is why they've created those videos. They're going to be there for you, right? And following that, if you don't have the right compression, or let's say the top straps, you're strong and it's closer to you, and so it's up at, 30, 40, but you weren't able to get the bottom ones. Well, now you have a tighter strap at the top. So paying attention to this when you put these on and working with your therapist or the fitter to make sure you have them on right is very important, as they're a great product, but they have to be on correctly. So with those AccuTabs, they're great to kind of get to that millimeters of mercury or whatever, but I find some of my patients either can't see them, have a hard time kind of with them being off onto the side and looking around. So in the clinic, we've kind of found that as therapists, we're good at finding that pressure or setting it up. And so we'll use a visual down the front of the shin. So sometimes chalk drawn. So once we have it all on the right way, we'll draw a straight line down the shin and make the patient line up so the chalk goes back in a straight line. So they don't have to look on the side for the AccuTab. If for some reason I've misplaced my chalk, I'll take those AccuTabs and turn them vertical and put them straight down the shin. So they have to line them up. And so we can kind of try and get close to the millimeters of mercury, but it just gives a different way for patients to see how to put them on properly.
Exactly. And that brings up a really great point, because for lymphedema, and again, from kind of the manufacturer's understanding, what we're looking at is that comfortably snug is something that a lot of therapists use. A lot of our garments are comfortably snug, right? That's just setting them so that it's not painful, but it's to the point where you as a clinician understand what that level is supposed to be like, how that's supposed to feel. So I like your version of doing that, because that's basically what we're trying to do with the AccuTab. We're trying to give the patient a way to mimic what you are doing. So whether that's that exact millimeters of mercury, or just finding a way of getting to that same level of compression, that's awesome.
I can't take credit for it. I learned that from my mentor, but it works. So, but the other problem sometimes is, it fits really well around the calf, but maybe the ankle has more swelling, or vice versa, right? Everyone swells a little differently. And so one strap or two may need a little bit extra. And I know you guys have a solution for that as well.
Yes, if you happen to have a garment and it's like, ooh, I need a little bit more up in the calf. And this is actually myself. I have a large calf that's a couple centimeters over the large size, and my ankle is the very smallest it can be in a large. So my calf is just a little too big. So I grab a couple of these strap extenders, and they stick via Velcro right to the end of the strap. And that gives me up to 10 centimeters of extra circumference. Now I can do that on one strap, I can do that on each strap, but that gives you the ability to fit in between sizes. Or you had mentioned how you have found uses for this sometimes for reduction.
Mhm.
I have had therapists who have sized down the garment and then got a strap extender for each one, so that there was more room for decongestion to take place. Talking about decongestion, we actually have another product called our Reduce. The Reduce is designed to trim to fit. So like, for example, we have a nice little knee bend here. We have our Velcro putting it together, but we're able to take a Compreflex with the same stretch panel, the same straps, the same material, and give them a custom like fit with that back panel. These can accommodate up to 90 centimeters in the calf and 125 in the thigh.
So we talked a lot about the leg, because that's where I use Compreflex most of the time, and I think that's kind of the big bulk of Compreflex sales is the leg. But there is one for the arm, and this is where I joke that patients ask me if they can get it sooner when they find out about it, is because they want to replace the bandages with
Yeah,
it.
I can imagine.
Don't get us wrong, as we're talking about, reduction and stuff, those are for those circumstances where bandaging is not realistic.
Exactly.
No one likes bandaging.
Exactly.
We understand. But it is the gold standard for a reason. Don't get us wrong. We still do bandaging,
Yep.
but there are options when certain circumstances pop up. And I see it most often with my arms, as my women are just like, please. But there is that arm piece, and I really like this one, especially when women are having to go through continued treatment, or something happens where maybe they went up one size and I need to get them down just a little bit, and bandaging is just torture for that little tiny bit. But they do have the Compreflex for the arm, and again can be used at nighttime, stuff like that.
We kind of talked about the Compreflex material. This is the same material. It's going to have the same type of Velcro, the same type of containing fabric, but our stretch panel, that retention panel, looks a little bit different on this. So inside the garment, we have a full length sleeve. This is going to be a little too small for me, but you'll be able to see that a full length sleeve that is going to encapsulate the patient's arm, again, kind of making it more accessible, allowing them to wait until they've got it positioned correctly and not fighting against the garment.
Holds it in place so you can put the
Exactly.
straps on correctly. 'cause it's
Exactly. So you're
not
not
compression in and of itself.
it's not compression in and of itself. It's to help keep you from fighting the garment. Got nice padding at the wrist and axilla. And then one of the big things about this garment that's going to feel different from both other wraps and bandaging is going to be the elbow. So we have a neoprene, which is just a very flexible elbow piece here. And we have removed a strap that would normally cover right across the inside bend of the elbow. Most garments, or when you bandage, you have that same level of compression that binds into the elbow, making it more cast-like, a lot less flexible. So what we have done is we have completely removed that strap and replaced it with a secondary strap, which will span the gap. So this will flex differently because of the way it attaches with those little prongs, and it allows it to flex and bend without compromising your containment, especially if you are using this garment during the daytime as well as like nighttime, and you need to maintain your independence and your flexibility. This is an amazing garment that's going to flex and allow you to retain motion a lot better than other wraps that I've currently seen or bandaging, just because of how we've addressed that elbow bend specifically.
And that's one of the big reasons women beg me for it instead of the wraps. Is I can move.
What do you recommend for a handpiece with this?
So a lot of the times I end up bandaging the hand if they need hand containment.
Okay.
And this is partially because of my population, is for some reason a lot of them that I put this in tend to be nurses and stuff like that. So when you go put Velcro on them, it complicates things. So the finger bandages is much easier. That's my population, right?
No, that's it's very interesting. We hadn't talked about this. That's why I just kind of thought about it. Is you can actually use a number of different hand options. So like you mentioned, bandaging, our dorsal pocket glove, if you have that swelling in the dorsum. But another piece that I would recommend you working with is the secure gauntlet. It's a hybrid circular knit garment with more containment, a nice long wrist extension with less compression in the wrist for that transition, but fully adjustable fingers, full compression around each digit, and none of the seams that typically are problems on the inside or outside of the thumb. But for someone wearing it during the day, you have that garment style for the arm, that high level of containment. And then for the hand, if they don't need quite as much containment, definitely that secure glove is an amazing piece, and that gives them a lot more flexibility and freedom in their hands. The dorsal pocket glove, you still get, quite a bit of movement, but again, kind of your profile of your patients there, I would suggest that secure glove as a recommendation to go along with this.
Awesome. So this has been great. As we both kind of preluded to at the beginning of this, is we love this product and we can talk forever about it. And there's a reason for that, right? But this isn't the garment for every single person. And so, and Sigvaris knows this, I know this, right? John knows this.
Yeah.
So there are other products out there, but and we will be talking about these and whatnot in future videos. And Sigvaris has all this stuff on their website as well. We'll make sure we put a link in the description here. But reach out to Sigvaris, right? You can go on their website, you can reach out to people, reach out to dealers that say they're Sigvaris reps, your therapist, all of that stuff. If you have questions, if you're a patient, right? If you're a therapist, go on Sigvaris website, reach out to the local rep for you. They're incredible. They bring bags and bags of stuff to show you. It's kind of fun.
It's like Christmas, isn't it? Like,
It is.
Oh, all right, Merry Christmas, bring the big bag.
But there are products out there, and as we've mentioned before, the only compression that's going to work is the one that you wear. So, look into it, know the different resources out there. If, Copperflex is it, great. If not, look for other options and find which one's best for you. And that's kind of what we're doing here, is talking about the different ones so you know which one's best.
Well, thank you so much. I really appreciate the time again, and I can't wait to join you again and talk about another product.
Yes, thank you so much, John.